Static from your side.
Good evening, everyone. A very warm welcome to all of you, and thank you for joining us for this special discussion titled as Beyond the Skin Understanding Vitiligo, Acceptance and Empowerment. I'm Dr. Muskan from Voice of Healthcare, and it's my privilege to have uh, conduct this session for today's discussion. This session is organized by Voice of Healthcare in association with Glenmark Pharmaceuticals with the aim of raising public awareness about vitiligo, addressing common myths and misconceptions, promptly some early understanding and support, as well as fostering more inclusive and accepting society for individuals living with the condition. Through this discussion, we hope to bring together medical expertise and lived experiences to empower patients, caregivers, and the wider community with accurate information, some practical insights, and messages of confidence, acceptance, and hope. Vitiligo is a common chronic autoimmune condition characterized by loss of skin pigmentation due to the destruction of melanocytes. While medically it is neither contagious nor life-threatening, its still impact often extends far beyond the skin, affecting emotional well-being, self-esteem, social interactions, education, professional growth, and overall quality of life as well. Despite growing scientific understanding and advances in treatment, many individuals living with this condition continue to face misconceptions, stigma, discrimination, as well as psychological challenges. Keeping all this in mind, we are privileged here to be joined by an eminent panel of experts and a patient advocate as well, who will bring us together some clinical expertise, psychological insights, and some lived or experiences to bust all these myths today. Allow me to introduce our distinguished panelists
Muskan,
for today.
Muskan, may I just interrupt you, before you introduce us? Sorry for that. Good evening, everyone. Can you please also say this is a Voice of Healthcare, program with Glenmark, but most importantly, this is with the Pigmentary Disorders Society. I think that part has been missed out and needs to be rectified. It is a Pigmentary Disorders Society.
Correct. Thank you so much for the, I would say, the remarks, ma'am. The session is organized by Voice of Healthcare in association with Glenmark Pharmaceuticals, as well as supporting Pigmentary Disorders Society. So from that, I'll take it to introduction of our distinguished panelists, starting with Dr. Rashmi Sarkar, President, Pigmentary Disorders Society, Director and Professor and Head, Department of Dermatology, Vardhaman Mahavir Medical College and Safdarjung Hospital, New Delhi. Welcome, Dr. Rashmi.
Thank you.
We have Dr. Bhavesh Swarnakar, Secretary from Pigmentary Disorders Society, Senior Consultant Dermatologist from Indore. Welcome, Dr. Bhavesh.
Hello, good evening.
We have Dr. Shikha Bansal, Professor, Department of Dermatology from VMCC and Safdarjung Hospital, New Delhi. Welcome to you, ma'am. We have Dr. Shreya Poddar, Founder and Consultant Dermatologist from Astra Skin Clinic, Kolkata. Welcome, Dr. Poddar.
Thank you so much.
We have Professor Dr. Om Prakash Singh, Consultant Psychiatrist from Manipal Hospital, Kolkata, former President and Indian Psychiatric Society, founding President of Psychodermatology Association of India. Welcome, Dr. Singh. And I think we are joined by Mr. Rajiv as well, a certified herbalist, a fertility forever counselor, vitiligo patient and guide. Welcome, Mr. Rajiv. Sir, you are on mute. Mr. Rajiv, you are on mute. You have to unmute.
Yeah, good evening. I'm Rajiv. I'm a certified hormonal herbalist, but today I'm joining you as a patient and advocate for vitiligo because I've been walking through this journey as an advocate first, and then as a herbalist, and then finally becoming a patient because I contaminated it after doing the third round of medicines post COVID because I had three times COVID. So this disease I contracted after the COVID only. So I would like to speak about it since I've researched on it. I'll be very happy to speak on how a patient or how a affected person really works on it.
Okay. Thank you so much, Mr. Rajiv. It's a pleasure to have you with us. I request all the panelists to kindly mute yourself and only unmute when we invite you. Thank you so much, everyone. With all that, I thank all my panelists for taking time to join us for this important conversation. And without further delay, let's begin our discussion. And through this, first, aim to establish a scientific understanding of vitiligo while exploring the emotional impact of diagnosis as well. So I'll start with Dr. Rashmi. Ma'am, vitiligo is often perceived as a cosmetic concern rather than a medical condition. So could you explain the underlying autoimmune mechanism that lead to melanocyte destruction and why vitiligo should be recognized as a chronic disease requiring some long-term management?
Is this question for me?
Yes, ma'am, it is for you.
Because I lost you, I lost you for a second. That's fine. So, first and foremost, good evening, everyone. And today is World Vitiligo Day. And of course, that that the theme is from stigma to strength. One thing that I want to put across very strongly here, this is an addition to what maybe Muskan said, is that this is an initiative first and foremost from the Pigmentary Disorders Society. This has come from the Pigmentary Disorders Society, and everything else, falls in place. So remember, for all the patients, you need to reach out. It is the Pigmentary Disorders Society, www.pigmentarydisorders-society.com. There are two S's. Coming back to your question, yes, vitiligo is a condition which is an autoimmune, disease. But remember that this is always autoimmune, mostly for a person with a genetic background, right? So the person has to have a genetic susceptibility to a certain extent. And autoimmunity plays a role. It's not purely genetic. So by autoimmunity, it means that certain cells of our immune system in the body, for example, the CD8 T cells, they start becoming a little toxic to the body's own cell, the pigment forming cells or the melanocytes, and they attack those cells. And because that is done, that is the reason that these cells stop producing pigmentation for the skin, and that is the reason that these become rather white. And then there are also cytokines. Cytokines, these are certain factors which set up a inflammatory reaction. So this inflammatory reaction, which follows an autoimmune condition of the skin, is the one which leads to vitiligo, and this is in a genetically predisposed individual. This is very important. So a genetic basis, an autoimmune basis, and this is how these cells become kind of foreign and attack the pigment producing cells. So this is important for the patient to know. Thank you.
Thank you so much, Dr. Sarkar. I once again thank you for extending, your support from Pigmentary Disorder Society and setting the stage so comprehensively and understanding that why vitiligo must be viewed as a common chronic condition, ma'am. So moving onwards, I come to Dr. Bhavesh now. Sir, based on current evidence, it suggests a complex interplay between genetics, immune dysregulation, and environmental triggers as well. So, what are the key factors that contribute to disease onset and progression? So, you have to unmute yourself once.
The person is having a genetic predisposition. The vitiligo is written in a person's genes, and these genes need some manifestations. So there are certain triggers which can start the disease, which may be environmental stress, it may be chemical, maybe UV light, maybe trauma, or stress. Stress produces a reactive oxygen species, and these all things lead to presentation of genes and an immune process beginning with that. And that is how the disease process starts. And stress also release alarming signals to immune system, and they start behaving on that. And they produces abnormal immunity against the melanocytes and start damaging that.
Thank you so much, Dr. Bhavesh, for explaining the underlying factors that are, very crucial. And actually, it is very important for us to recognize the condition early, and it will help us in diagnosis or accurate diagnosis as well. Moving onwards, and we'll come to some clinical presentations. Dr. Shikha, we would like to understand from you, ma'am, what are some common clinical presentations of vitiligo, and how can timely diagnosis can influence treatment outcomes as well as long-term disease control?
Good evening to all. So, the patient usually presents with, most importantly, non itchy, painless, milky white lesions over the body. They can be localized, as in one or two. They can be generalized. Multiple lesions are present. One of the common presentation is lip tip vitiligo. Lip lesions present on lip and tips of the fingers, and they can be mucosal also. And the other common thing is it is stable, the lesion is there, they're not increasing. And the other presentation is that it is progressive. So their varied presentation, the common undertone remains that the patient presents with milky white patches, and very less often it can be associated with other systemic illnesses like anemia or diabetes as well. The other important part of the question which Dr. Muskan asked was how important is early diagnosis and intervention. So, in my clinical practice, I devise this line hit early and hit hard, because there is a certain reservoir of melanocytes, or in simple language, pigment producing cells, which is there in the body. So, if we are little more proactive with diagnosis and treatment, we are able to give a better response to the patient. So, thank you.
Thank you so much, Dr. Bansal, for jotting down all the signs that typically present in patients, and you definitely mentioned about the varied presentation that we have. As we have been talking about autoimmune disorders, we'll move forward and talk a bit about those more. Dr. Shreya, we would like to understand from you, ma'am. Vitiligo is frequently associated with some other autoimmune disorders as well. So, what are the comorbidities should clinicians be vigilant about, and why is a holistic evaluation super important?
Right. So thank you so much. So we know that vitiligo is an autoimmune condition. So of course it can have autoimmune associations where other organ systems are also involved, right? So that is why it's very important that we look beyond the visible white patches and adopt a holistic approach, because early identification of these conditions are equally important to avoid their long-term complications. So if I talk about the common comorbidities, particularly the autoimmune ones, so let me just brief it. One would be the endocrine association. So most common that we get is autoimmune thyroid disease. Apart from that, we can get type 1 diabetes. We can also get Addison's disease in barely in some patients. So we need to look out for that also. If we talk about the skin autoimmune associations, it could very frequently we find alopecia areata that is coexistent in a patient of vitiligo, where we get these circumscribed bald patches, particularly behind the ears or in certain areas of the scalp or the eyebrows or eyelashes. Then we can have pernicious anemia. We can have even autoimmune connective tissue disorders like SLE, rheumatoid arthritis. So we need to be vigilant, and not strictly autoimmune, but the most important other association would be the mental health conditions, social anxiety, depression, phobia. So these we need to be very vigilant for, and early identification, like I said, with help will help us collaborate with other disciplines earlier, and will give us more holistic outcome of the treatment of the condition.
Thank you so much, Dr. Badar, for highlighting the comorbidities that are associated with the condition. And I think you clearly mentioned with your insights that we need to be more careful about having the comorbidities and diagnosing the vitiligo. So, while understanding the disease medically is essential, as discussed by all the panelists, the emotional experience of living with the visible skin changes can often be equally significant. So, my next question is directed to Professor Dr. Om. Sir, we would like to know from you that why can a visible condition such as vitiligo have a profound impact on an individual's identity, emotions, and self-perception, sir, even when physical health remains largely unaffected.
Uh, Thank you. As we know that vitiligo, the harm is maximum due to psychological causes. Not, in fact, the physical causes does not cause so much harm as the psychological causes. And as we are discussing, the first thing is that a lot of psychiatric disorders are autoimmune disorders or immunological disorders. And sir was Dr. Rajiv, Mr. Rajiv was mentioning post COVID, there was a lot of increase in anxiety and depression. So there were social factors were important, but the cytokines and others were also important, which increase depression. So there is a bidirectional relationship between increase in inflammatory markers and psychiatric disorders like depression and anxiety. So that is one. Second thing is that vitiligo has been associated along in our culture a lot of times with leprosy, and so that has lead to a lot of stigma that it should people should be isolated, we should not mix with them, and a lot of things. In North India, there will be a lot of advertisements that Safed Dag, and which includes all these disorders. So there has been huge stigma, and anybody which contracts the illness, particularly the adolescents and children, they are isolated. Even one of the girls I saw, so she would enter with the teacher and then again go out with the teacher because nobody will allow her to sit near her. So these are the things which leads to loss of self-esteem, a lot of psychological disturbances, social phobia, as Dr. Shreya was mentioning, and depression and anxiety. And third is, of course, the beauty concept of beauty and anything related to body image and self-esteem related to beauty. There are, I will not go into detail of this because itself it is something very huge and kind of elaborate discussions are required. But this leads to a lot of perceptions that I'm not beautiful, I'm not be acceptable, and that leads to a lot of social problems and anxiety and depression. Thank you.
Thank you so much, Professor Om, for the explanation description. And I think you rightly mentioned about the major phobias which the patients face as well. Uh, so, talking as we are talking about something scientific, Professor Om, can you mute your mic? There was some disturbance.
No, not from my side.
Thank you so much, sir. So, as we are talking about the scientific and the psychological perspectives, which are very valuable, but we have to, illustrate about the reality of living with the condition. That is quite a personal experience. So, I would like to thank Mr. Rajiv for joining us very well here. So, sir, we would like to, uh, we would like to know from you that when you first noticed the changes in your skin, what was your journey to diagnosis like, and what information or support do you wish you had received at that stage, sir?
So can I? I think now it's good. Can you hear me?
Yes, we can hear you clearly.
It's a very different question. I mean, I have no answer to it because when I noticed it, it was a very small spot, which is actually everyone said ki it is not to be bothered about. It is a white spot. Don't worry. This keeps coming and going. A lot of people kept on telling me that okay, look at my face, look at my hand. There is a small spot, so don't worry about it. But that small spot didn't enlarge till today. Honestly, it's been now that small spot is there with me for last 7 years now, but nothing has happened on that spot. But my anxiety to correct that spot or to look at that spot differently and to start looking at everyone who had a vitiligo or who had white blemishes or who had some white spots in their skin, and me looking at my friends or my colleagues or the people I kept meeting during my international journeys, and I used to get more anxious about that white spot. So I think if somebody had told me ki how to hide that white spot or not to bother about, or how to take care of by growing a beard and around it, or just whiling away that white spot, I would have been much more comfortable. It's my anxiety, as Professor Om Prakash spoke about. I think it was more of my anxiety on hiding or correcting that white spot that that flared up the whole thing. So that white spot started white spot on my tip, on my one of the fingertips, and that's where I started thinking about that maybe the vitiligo has that I've contracted SLE. So I started meeting various clinicians, especially on SLE side, and they started talking about autoimmune disorder. They started educating me more on that. Okay, how do you take care of your sugar level or your basic parameters, or what kind of medicines you should have. And I was always looking at that this white spot should go away. Should I do some topical treatment, or should I take some oral medicines to walk around it? But it was just by the time the COVID started, and I contracted COVID, and I was admitted for about 12 days in one of the isolation wards. And since I was part of the team taking care of emergency support from the from my own practices side, so I was given a best of the treatment. But during this time, I found that the spot on my tip, the that went into on the thumb also. And then again also I didn't bother more about it, but the journey means my anxiety would have settled down, which I have now met many people who have contracted vitiligo, and they are taking care of it by hiding it, by hiding, when I say hiding it, by using a kind of a cosmetic foundation on top of it, so that when you see yourself in the mirror with that spot or with those spots coming up, that's where you actually get more and more sucked into that psychological or some means the depression, or some it flares up because of your psychological conditions, which is due to the white spots coming onto you. So it starts with your cosmetic disorder, not through any other genes or any other morbidities or comorbidities. I believe so. It's my journey starting from 2017 of mapping that white spot till today by flaring it up in that level that I've stopped bothering about it, is purely that I was more conscious about why that white spot is there.
Thank you so much, Mr. Rajiv, for sharing your. So you can mute your mic. So thank you so much, sir, for sharing your real life experience, and it is a privilege to hear those kind of experiences and the heartfelt scenarios that you went through on this initiative. So at this, we have learned a lot about the importance of diagnosis, the condition, the psychological impact, and the lived experience as well. At this juncture, on behalf of Voice of Healthcare, I would like to extend our heartfelt appreciation to the Pigmentary Disorder Society for their support and endorsement for this important initiative of awareness. We are grateful for their dedication to promote greater understanding, early diagnosis, and the holistic care for individuals living with vitiligo. So, moving onwards, we'll talk a bit more on challenging misconceptions and understanding that how stigma is developing and affecting the individual. My next question is to Dr. Rashmi. Ma'am, despite decades of scientific progress, myths surrounding vitiligo remain widespread. So, what are some common misconceptions that you continue to encounter in your practice?
I think there are many myths which circulate about vitiligo. Because in India in general, any kind of change in the color of the skin, whether the skin looks whiter or there is a dark spot of the skin, makes a lot of difference to the patient overall, the general appearance. Because I think color is a very important thing overall in India and Asia. It also refers to a patient's identity in some way that is historical. So the thing is that some of the myths which circulate is that this is a disease which is infectious. Is it contagious? And we know that this is neither contagious nor infectious. It has an appearance, more of a cosmetic appearance, but also it's a medical condition because it has a psychological connection with the mind and needs to be treated. The other thing is, of course, regarding diet and vitiligo. There are so many misconceptions that eating this is a problem. Can it cause vitiligo? Like a lot of patients ask, कि खट्टा खाने से खट्टा बंद करना चाहिए कि नहीं. This is a very common thing, खट्टा बंद करना है या बैंगन बंद करना है. These kind of things, they want some diet to be stopped. And also the perception that milk and fish eaten one after another, then whether this can cause vitiligo, which there isn't really much of a truth about that. Then there are so many other things. That is it a kind of a curse from previous birth? This is there in some of the rural areas. That there is no such thing. Vitiligo is not a curse. It is a genetic as well as an autoimmune disease. So these are just some of the myths which exist about the disease, but I can tell you that there are just many. There are hundreds of myths, about vitiligo. I'd like to tell the patients as well as the public, who are watching the show, there is no such thing. Vitiligo is like any other disease, and there is a good amount of treatment for that. It may not be the most perfect one, but to a great extent, we can make sure that the patient with vitiligo lives with a lot of dignity. Thank you.
Thank you so much. Thank you so much, Dr. Rashmi, for enlightening us about those myths that continue to, I would say, influence public behavior as well. And you cleared it out, ma'am. Moving onwards and continuing, as Dr. Rashmi was also mentioning, that misbeliefs such as vitiligo being contagious as well as linked to poor hygiene persist in many communities. Dr. Bhavesh, we'd like to understand from you, sir, that how can science help dismantle these harmful narratives?
Actually, first thing is that there are multiple approaches. Like first, you have to really educate the society at various fronts. School-going children, school need to educate the teachers, the counselors in the school, and the classmates. In office setup, you have to educate the staff and all the people living with the vitiligo patient. Thirdly, in the family and the relatives, you tell about the disease, that it is an autoimmune disease. It does not have any link with the hygiene, and it is not a contagious disease. There are certain diseases which spread through contact, but vitiligo is not among them. So sometimes we can just because we have got a lot of things to disseminate the information. You don't need to go one to one to everybody and tell them. Like this webinar itself is a dissemination of the information. So scientifically, we have to use social media platforms. You can have a lot of pamphlets. School teachers, counselors can educate. If somebody is bullying the student, then the counselor can help the child to get out of it, and also the students can be taught that they should not behave like that. Apart from that, educate about the prevention from the relaxation from the stress, or the shade zone for the students, because UV light can directly trigger these things. So these are the things, and I think the social media platform is the best thing to disseminate the information, and that is what I would say more scientific than anything else. Thank you.
Thank you so much, Dr. Bhavesh, for clearing those misbeliefs and sharing insights on education as well as prevention that can help to move forward. So, as we're talking about misinformation as well, Dr. Shikha, we would like to understand from you, ma'am, that how does misinformation influence healthcare seeking behavior as well as treatment adherence and patient outcomes?
Thank you, Dr. Muskan. So this question is very pertinent because a lot of myths and misinformation leads to delay in consulting a dermatologist. There are a lot of unproven therapeutic remedies which the patient tries, and by the time they come to us, the disorder is well established. The other myth is unrealistic expectations. So patient swings from one side to the other. One set of patients would say nothing can be done now, and the other set thinks that I can be completely cured and never to have this again. So we have to align the expectations somewhere in between. And lastly, most important thing is that the patients think that the treatment options come with lot of side effects, like steroids will be given topical or systemic, which will lead to lot of adverse effects. So these are the common unrealistic expectations, delay in diagnosis and treatment, and myths regarding the treatment, which delay the right treatment options to the patients. Thank you.
Thank you so much, Dr. Shikha, for sharing those important points. And as you mentioned about delayed diagnosis, my next question is related to that, and we'd like to understand it from Dr. Shreya that what role should healthcare professionals, advocacy groups, as well as media platforms, like Dr. Bhavesh was mentioning, play in promoting accurate awareness and reducing stigma, ma'am?
Right. So I think reducing stigma around vitiligo needs an absolute collective effort by the doctor, by the advocacy group, and the media platform as well. Coming to a healthcare practitioner, we need to provide accurate evidence based information. We need to dispel the myths, as everybody was talking about. We need to encourage open ended conversations about the mental health of the patient and the emotional aspect of the vitiligo, which we often tend to, ignore or not mention, or it's under the table. It's not openly talked about. Then we have to empower patients and decision making. And something that I very commonly see in pediatric vitiligo, it's not the child who's bothered, it's the parents who are bothered. And they are so worried that they end up instilling that, stigma of self doubt from the very beginning. So if we try to counsel the parent that, look, it's not in your control, it's not in the child's control, and if you don't instill that seed of self doubt, your child will probably go off more confidently and will not land up with that mental stigma that this disease has. Now coming to advocacy groups, I think we need to create the groups need to create safe spaces. We don't have too much of vitiligo support groups in our country that we have in other areas. So we need to have safe spaces for patients where they can talk about their condition freely, have their experience sharing. We need to have community outreach programs. We need to have more of awareness programs, and we need to advocate for better school and workplace inclusivity because they are often avoided, bullied, so that needs to be advocated for. And regarding media platforms, of course, dispelling the myths, we need to increase the representation of people who are living with vitiligo in public platforms, in the entertainment industry, because once there is acceptance and inclusivity, I think the battle is fought.
Thank you so much, Dr. Shreya, for mentioning all those valuable insights which all the healthcare professionals should follow, the caregivers, as well as the media platform are. My next question is to Dr. Om regarding the visible differences which often became, target of prejudice, stereotyping, or social exclusion. So, what does this reveal about human behavior as well as societal conditioning, sir?
Uh, it is a very tough question. Human behavior depends on a lot of things, and human always try to preserve themselves first, like we are animals, and self-preservation is very strong. And anything which we consider that it is contagious, it can come to me, and we are not knowing about that illness. that becomes increases stigma. We become fearful, and we try to isolate the patient. And it has been done for kind of syphilis, leprosy, tuberculosis. It is done for mental illnesses. But when treatment is available, then people accept that. So first thing, even for HIV, that there is no harm to them. So that thing has to be put repeatedly, that there is no harm to them. That will help them to integrate with these patients. So that is the most important thing, and that is the human behavior, which is self-preservation, as you talked about. So that is very important. And second thing is, uh, nowadays we said that as social media, so we should have some informations. If somebody searches on AI, they should get the right information. So we should, professionals have a duty to put right information in kind of internet and others, so that which is searchable. And third thing is a lot of visual hand holding, touching these patients, teachers holding these patients for school. So that is very important to visually portray that this is not infectious and this is inclusive. So that these are the things which human nature will be like this only, but we have to go with that and try to make it acceptable to all the people. Thank you.
Thank you so much, Professor Om. And you rightly mentioned, sir, that awareness is the first most key that should, people be aware of, as well as the right answers that they are searching for. So, coming to Mr. Rajiv, can you, share some experience where a misconception about vitiligo affected you personally, and how you responded to that situation, sir?
Yeah, thank you very much. This is something very dear to me because I keep talking to all the patients. I keep meeting within my own community. I've created more than about 1,600 people who are already suffering, or who are already having vitiligo with them. And now most of them have become my personal friends. So we keep chatting about it. That how do you face the new people whom you acquaint with, or you get into network, or you get into socializing. The first thing which I see, I come from a family of clinicians. Almost everyone in my family is a doctor, and they understand SLE, they understand autoimmune, etc. So, and also myself being a hormonal herbalist, so I knew about how the hormones, etc., and the how hormones really lead to can help me into the vitiligo side or the SLE side. Now, the first thing which was a shocker to me when I started, when I was traveling, and my towel, or nobody was sharing me their towel with me, or once the towel was given to me and I was wiping my face off, they were just using it as if they will get contaminated, they will get affected by my towel. So that really, and I was alone and there was nobody around me, that really affected my psyche so badly. And then the third thing which happened to me was that after the first round of COVID, I was supposed to travel to US with my couple of marks on my face. I went for my the visa, that the scanning part, and my earlier visa was rejected. So I was shunted out from Abu Dhabi airport because they said that your face is not recognized by the system. Then one of the person, she came out. She was very kind. She was an Arab, and she explained it to me that because of these marks, the scanning is failing. So that was a big shocker to me, and I had to travel back and look at. So I started thinking about, should I go to a cosmetic surgeon, or should I go to a makeup artist, or what should I do about it? The only solution which I found is that forget about going to US, or forget about any country which is going to scan your face. Let me live the way I. So from there, as my other panelists and dear specialists have spoken about, I started openly talking about that. What should I do? Somebody said कि आप खट्टा मत खाओ, आपने दूध के साथ मछली खा लिया होगा. And frankly telling you, I keep traveling to Bangladesh, Dhaka, where everyone is having milk and the fish together. It's a big treat when you go to a party over there that you have a curd, lassi, and also a fish, and along with the rice. This is their most respectable dish. So I used to think about that. Are Bangladesh is more vitiligo prone, or am I the one sufferer? What should I do about it? Now, during this journey, when I met other co-vitiligos or co-vitiligo patients, I found I call them my brothers and sisters because by the time I joined a World Vitiligo Research Foundation to understand why and how this disease can be controlled or can be really, if not mitigated, how can I arrest it at that point itself? Now, during this time, the worst thing is that I started losing friends, means my socializing friends. And a couple of dermatologists who are known to me, they said कि आप बियर बहुत पीते हो इसीलिए आपको विटिलिगो और फैल रहा है. Now I am one of the investors and founders of big beer company. Now that brewery, so I was always a tester over there. Now, this is where I wish that we should speak more, or we should talk in social media. As one of the panelists suggested, that we should, like Dr. Shreya suggested, that we should be having more. I call myself, I'm having a QR code. So now I say that, okay, look at my QR code. It's different. So you won't believe that this is my third. I keep traveling to US, so this is my third now visa scanning, and my third passport has been made because my QR code keeps changing. So I've started living with it. So I keep telling people that don't worry about it. It's another step towards it. What is really required is that we speak more openly about it. Some kind of maybe a heroine who's got an actor who's got a vitiligo, she's shown, or a kind of OTT which is spoken about it, so that people don't consider us a truth now. This is the biggest thing which I find amongst my brothers and sisters. They say that key people don't really want to touch us, they avoid us. So it's very emotional thing, but yes, I've started now looking at that as if I do not have it. So if somebody wants to come and meet me, it's fine. If they don't want, that's their problem, not mine. This is how I've evolved over it. Now, I can't blame that why the COVID came to me. I was affected in COVID twice because I was the one of the person who was really helping the patients. Now, during this journey, maybe it has affected me or not affected, but yes, I keep thinking about that whom should I meet or whom should I not meet. So it affects emotionally, it affects psychologically. The towel incident really awakened me a lot. And then the visa scanning was a shocker to me. And that too in Abu Dhabi airport, where it is supposed to be a straight entry into New York, and you just fly down to for that, and you're stuck into it. I think it's enough for me to answer on this. Thank you very much.
Thank
Just,
Thank you.
I just wanted to ask you, how did you resolve that visa issue actually? And this is quite important. That what did you ultimately do regarding this?
Last 2 years, this is my third passport. So I've been changing means I'm renewing my passport with the new images. That's the only answer. Hello? Yeah,
yes,
Yeah, it's a
Professor.
tough task. It's a tough task, but
Yeah, it's a
okay.
tough task, but either you stop traveling or you stop living with it. So since I can't stop traveling, so it's my business also.
Agreed.
Being a herbalist, I keep meeting a lot of people especially on my profession of fertility. I keep meeting so many people. Now, some of my, I don't call them patients, but I counsel a lot of people. So some of them say कि हम आपसे video interview ही कर लेंगे. That's okay for them. Some of them say, okay, we'll do a face to face. So I make sure that when I go after the towel incident, I make sure that I carry my towel all the time with me. I'm sorry to say that, but that's the way it is.
Thank you so much, Mr. Rajiv, for sharing those real life myths and information that you have really faced, and all the candidates that who have shed lights over this misconception that everyone or the patients go through. So moving onwards, we'll talk a bit more on naturally about emotional and the social dimensions of living with vitiligo. So my next question is to Dr. Rashmi. Ma'am, increasingly quality of life measures are being, recognized as important clinical outcomes. So how significant is the psychological burden associated with vitiligo from a clinician perspective?
I think we've been talking about this, Muskan. I think this is very substantial. That is exactly the reason why we call vitiligo a medical disease. Somebody might say it's a cosmetic concern. They're just white patches, nothing else. But it's not that. There is so much of an effect on the mind, whether it is, a decrease in self esteem, or whether it's a psychological stress that you have, a feeling of isolation and loneliness sometimes. Think of some of the children in school, because at the time when you're in school, the other children may not really know what it is about. We adults, now we know there's a lot of knowledge, information about vitiligo. So children, can actually bully that child with vitiligo. Sometimes if the teacher is not looking, or call all kinds of names. What kind of names are there? You can be called a safed bhoot, or you can be called, a safed hathi or anything. I've heard such names, very strange names, because like to really club people with all kinds of names. So this is where the teacher's role comes in, to keep a special eye and attention, to the child who has vitiligo. Maybe just look after, make sure that the child is surrounded with a friend or two, because, children as they grow up, they learn about it. But even as small children, let me tell you, they can be quite mean, they can be quite cruel to each other. So it should not start from school, because it has so much of an effect, on your psyche. So this is one thing. Parents themselves have to take care. They have to be very confident, so that the child, is also confident. I've had patients coming to me from all over India. I meet them not only in the hospital, but even when I'm traveling. If somebody wants to come, I've never said no. I met them in the, hotel lobbies. I met them outside sometimes in the shopping malls. I've never said no. I remember parents coming with a child, a grown up girl, who was actually working almost as an executive. She was not so bothered. She knew all about it, being a very educated person. But parents were really worried. And the way they talked about it, it was very important for that patient to have a lot of self esteem, which she did, so that made a difference. So it has a lot of psychological stress, which is the main thing that has to be addressed. There can also be thoughts of suicide sometimes. When you have too many of them, there is a problem in your marriage that is coming up repeatedly. And not necessarily in your own marriage, it can be the marriage of a sibling also, right? Your mother may be having vitiligo, and you're not able to get married, or the sibling has a problem, or professionally, that somebody might see that you have vitiligo. Although now there is knowledge, you see that some of these people, are gainfully employed. I think some of you know that some of our, big labels, they do take up people who have vitiligo and use them, as people in the shops and all, which is a very good move. But it can affect your occupation and marriage. So it has a very long, role, a very, big role on your psyche. And that is where psychological support comes in very handy. Thank you.
Thank you so much, Dr. Rashmi, for sharing your, I would say, real life situation based knowledge, ma'am, and insights with us over the quality of life measures that you clearly mentioned. So, talking a bit more on this, Dr. Bhavesh, as ma'am was also mentioning, are there any particular life stages such as adolescence, young adulthood, marriage, or career, as well as progression, where the impact of vitiligo trend tends to be, especially pronounced?
See, actually, Dr. Rashmi has elaborated a lot about the social and the psychological impact. Okay, the problem starts like from the childhood. Parents keep discussing about the child's problem at home. Child is not aware about his problem. Every day when we are talking, even the child is sitting in other room, he is listening to you. And we keep talking about his life, that इसका life खराब हो जाएगा, इसका career खराब हो जाएगा, इसका क्या होगा. And that thing keep impregnated on the child's mind. So when he goes to school, and he feels very much distracted from others. And bullying is done only with those people who get bullied, because he's already having an impression on his mind that बच्चे मुझे bull करेंगे, and he's getting bulled. So first thing is that the parents education is very important. So this early stage is a school where you have a lot of psychological and identity issue, peer bullying and discrimination. So this is one thing. Secondly, as you grow, you come in your career as a professional, you feel a lot of biases or discrimination or client interaction. Like if you're having, like Mr. Rajiv has explained you so well, that if you're having a vitiligo on your hand, you are going to have shake hand. You people don't like to shake. They want to have more meeting on the Zoom or some online than meeting you. So you are very confident. I don't care about it, but society affects you somewhere, and it affects like that. Third phase, when comes you grow up, there are a lot of change issues like your health, hormonal issues. A female is getting married, she is on immunosuppressive drugs for treatment of vitiligo. She is planning for pregnancy, then the medicines has to be stopped. Okay, lot of immunosuppressive drugs are given. So there is a shift from that immune system for the treatment of the patient. Old age again, you get diabetes or you get thyroid. You give a lot of medicines to treat the disease. So there is things you have to take care about that. So, and when you're working, you are going outdoors. This can trigger your UV light can trigger your vitiligo, your stress, professional stress. Those who are having high pressure performance work, it can affect you that way. So these are the multiple things which can affect you, and you should take care of that. Thank you.
Uh, Thank you so much, Dr. Bhavesh, for sharing those important insights and major talk points for patient need as well. So, moving onwards and coming to Dr. Shikha, ma'am, beyond treatment-related concerns, what are some emotional and social challenges do patients most commonly discuss during consultations?
So a lot has been already discussed on this topic. So I'll discuss few real-time scenarios which I find relevant to your question. So once I encountered a line, white patches and scarred soles. So as Rashmi ma'am had initially mentioned, that vitiligo is not only a cosmetic concern; it's something much more beyond that. So I have found myself writing notes on OPD slips for teachers of the school who say that the vitiligo child cannot sit with the other students and the child is made to sit separately. So I write on the papers that this is a non-contagious disease, it is completely treatable, child is undergoing treatment, and kindly let the child sit. The second real time scenario is when people are applying for jobs, a permanent job, a government job, and then they are rendered unfit because of one white patch. That time I really get sad. And then I write notes that this is treatable, and then I put my stamp and hoping that it takes the patient through it. A third real time scenario I encountered, that a girl did not disclose that she has vitiligo before getting married, and while when she delivered and was lactating, then the mother-in-law discovered a patch on the areola, and there was talks of breaking up the marriage. So these are few important discussions where a lot of family needs to be counseled, and as a clinician we have that authority and that expertise and knowledge which we can share with the family, and if done correctly can really save jobs and relationships. So that time I feel that I have an important role to play. Thank you.
Thank you so much, Dr. Shika, for highlighting the importance of counseling, ma'am, as well as recognizing emotional and social distress is also an important aspect of holistic patient care. So, moving onwards, Dr. Shreya, we would like to understand from you, ma'am, that how can dermatologists identify, signs of emotional distress or ensure that mental well-being becomes a routine part of patient care who are suffering from the condition.
Right. So I think as doctors, we need to be attentive to both verbal and non-verbal clues during a consultation with a vitiligo patient. We need to pick up signs of social withdrawal if the patient is having a lot of fear of judgment, if they are having feelings of phobia, embarrassment, if they're talking about low self-esteem, if they are having interpersonal troubled relationships, if they are facing poor performance, be it a child in school or at a grown-up man or a woman in a workplace, and if the patient has been changing their doctor repeatedly, having unrealistic treatment goals and expectations despite proper counseling about the chronic nature. So all of these signs need to be picked up verbally and non-verbally. Verbal assessment is important with the patient. We should do a quality of life assessment. We should create a non-judgmental environment for the patient to freely talk about their emotional distress. We should also encourage participation for such patients in support groups where they can, openly talk about and share their feelings with other people about how they are coping up with the disease. And also we have to collaborate with a mental health specialist whenever we are picking up these signs of anxiety, phobia, depression, or any sort of mental distress.
Thank you so much, Dr. Shreya, for sharing those insights. And I think through this discussion, we know that mental health and skin health are often deeply interconnected as well.
Yes.
Moving onwards, we would like to hear from Dr. Om as well. Sir, how can repeated exposure to social judgment, staring, unsolicited comments or exclusions, affect self-esteem, body image, and relationship over time for the patient?
Uh, As Dr. Rashmi Sarkar was also mentioning, this is very, very traumatic. Though a lot of people who are professionally successful are coping with it, but still they are much distressed by it, and they feel kind of hurt, they feel kind of anxiety, and self-esteem is impaired always. And in any situation, they do not feel courage to take new risks. So a lot of personality changes occur. Apart from clinical depression and anxiety, there are a lot of subclinical things occur, which leads to restriction in their activities, not being open enough, being slightly be involved in themselves. So a lot of these things happen due to this. And of course, we need supporting families, supporting friends, and of course, supporting environment so that they can flourish.
Thank you
Thank
so
you.
much, Professor, for highlighting those realities. We would like to hear from Mr. Rajiv that looking back, what has been, the most difficult emotional social challenge that you have faced?
Great. Thank you very much for all the panelists. I'm so happy that I'm not so happy, but I'm happy. That's the kind of outcome when I speak about being a patient. Sorry to just share with you. When I meet a lot of young people or young students, those who have been affected, I keep thinking about what is the treatment if I'm a dermatologist like all of you. What will I provide it to them? Recently, what I did was in US. There is a team which has been researching on vitiligo, and I invested into them. I said that, okay, I'm one of your co investors, or I'm going to be one of your co founders. Why don't you let me come on the media also? Now, the shocking answer was that you are not media friendly. Your face is so affected that how can we bring you on the as a co founder or a part of the founding team? Now, the second thing which I did was I couldn't pull out my money because the returns were going to be very healthy. So, but till today, it has been now more than 18, 16 months that I keep thinking that did I do a right thing, or can I become a dreamer again, or can I be coming into kind of shorts or reels, or can I speak to people? Can I to meet the people like this, that if people are not letting me come on the camera, then can I come and meet people as a salesman? Or so how will it affect the people who are in the profession where it's a customer facing, or where there's a direct consumer facing? So I've been meeting, and my journey is that means my answer to this is that it is up to us that how do we face it and how do we live with it. So the choice is with us. But when all of you are suggesting that it comes into your teens, you don't get good girlfriends, then you don't get good boyfriends, then you don't get good couple to date with, means people to date with. And as you said rightly, I know two or three women who have got a broken marriage, and one of them is seriously thinking, will I be able to find a companion for my life because I've got this disease? So we need to be educating them, but how do we educate them? Because we need to find a solution for them. It's not the education, it's the ecosystem, or the people around us who have to be educated that okay, this is. And I come from a background where in North India we call this disease, as my grandmother or my in-law side, they used to talk about ye to filari hai. So it took me a lot of time ki what does it the filari means. So then somebody told me ki filari means it has to spread, ये तो फैलेगी ही फैलेगी. So when we say from a societal angle that ये तो फैलेगी ही फैलेगी, so from the day once you have a spot, every one of us gets into depression. So now I meet a couple of women, I mean the young girls, they keep telling me that the answer for this is only to do a lot of meditation. Meditation really reverses it, it stops, and it helps us to getting into that convolute of means getting sucked into the psychological trauma, that what will happen next, why people are moving away from me, why people are not. Because as I will suggest, maybe I'm wrong, because Professor Sarkar is a very esteemed professor, I would say let's stop talking about that it's genetic. The moment we say genetic, then we won't get any companions for the beautiful girls or the beautiful handsome boys or the people who are part of the family. So let's not talk about genetic. Like there are so many SLEs and there are so many immune disorders. So we call them all as a rheumatologist? Should we call them genetic? No, they're all treatable. I know now a couple of young girls, means the young ladies, they are part of the research on how they are going to be providing a topical medicines. I've given myself as a trial for third round of topical medicines for reversing a couple of patches around us. So the only thing which I request to everyone, including all of you, that let's not talk about genes, genetic, coming from the ages, coming from their, it's hereditary. These are bad. These really affect all of us very strongly. Thank you.
Thank
I
Thank
have
you.
something to say. Yeah, I have something to say. I know that we are nearing, sorry, we are nearing the end of time, but I think this is important to address. You know what Mr. Rajiv was also saying. I think we, as doctors and even a dermatologist or even a psychiatrist, we understand, we are sensitive. We don't talk so much about it being genetic, but most of the people coming to us have already read it from here and there, and people know that. So it's usually you've read from Google or So this is a question asked by almost everybody. This is since last so many decades, when we have been dating, that they will ask that it is a genetic. Now the answer is that yes, part of it is genetic, but so are so many other diseases. This is not the other. What? How do we know what we have? So all of us have many genes. So many diseases are genetic. It's not one particular disease, and it doesn't have to manifest necessarily in each and every person. So we don't know what you're doing, in the sense that even somebody who says doesn't have vitiligo could, get vitiligo later in life or have a child with vitiligo. So I think the percentage chances are the same for everybody. So I don't think we never propagate that, but at the same time, people read and come. But we have to be part of the change ourselves. So I'll give you an example. Like when I got married, in fact, my husband did tell me that a very important family member has vitiligo. So, I think they didn't want to hide the fact because you may not be able to see the spots all the time, right? So, I think I said that, it's an equal chance that somebody else can manifest some other disease. There are so many genetic disease. I, as a doctor, understand. And if I have to be part of the system, I accept it, because reason is that who knows, somebody may not tell you, but there are so hundreds and hundreds of other genetic disease. Are we taking care of that? So it has as much a chance as so many other diseases, as rightly pointed out, whether it is SLE or something. So that is another point which has to be explained. and we have to be part of the change, ourselves. So I think, that is something that I accepted, that, there are equal chances. So this is what I'm trying to say, that this is how education and information makes a lot of difference. And it's really nice that Mr. Rajiv is there with us and he spoke about so many challenges, some known to us, some not known. Thank you.
Thank you so much, Mr. Rajiv, for sharing your story as well as the struggles that you are facing. Also,
Yeah,
I would
no,
like to.
I wanted you to meet my companion. Here she comes, so she just joined me. Good evening. Can you hear her? Hello?
Yes, we can hear. Yes, yes.
Yeah.
Yes,
She's
we
my
can.
wife. She's my wife and a clinician. She's a gynecologist and a record holder. Now she's the one I keep asking, क्या मैं सुंदर लग रहा हूँ? क्या मेरा फेस ठीक लग रहा है या मेरे दाग बढ़ तो नहीं गए? She keeps telling me, नहीं और white हो जाओगे तो ज़्यादा सुंदर लगोगे. This is the everyday or every meeting, pre-meeting discussions we have. तो शी कीप सेइंग कि थोड़ा ये भी सफ़ेद हो जाएगा तो देखो और ज़्यादा अच्छे लगने लगोगे. सो मैं तो चाहती हूँ कि तुम सारे ही सफ़ेद हो जाओ. These are the discussions which keep encouraging people like us, rather than that we say कि इसकी ट्रीटमेंट क्या करेंगे, कैसे होगा, कौन ठीक करेगा, which is the right doctor. Thank
Correct,
you.
sir. So you definitely have the support system with you as well. So, aparting this, before we conclude, I would request each panelist to leave a message with us. So, in one sentence, I would request, what message would you like to share with individuals who are living with vitiligo on World Vitiligo Day 2026? So, we'll start with Dr. Rashmi.
That it's a message that has to be given. I'm sorry, I didn't catch your question.
Yes, ma'am. I'll repeat that. Before we conclude, we would like to hear a message that you would like to share with the individuals who are living with the condition.
So I think an important message would be for, anybody living with vitiligo, that please remember that, your self-worth, your self-esteem cannot be dismantled by the condition of your skin. It is the person that you are that has to come across strongly. And please do not equate, your skin color with your self-esteem or your self-worth.
Thank you so much, Dr. Rashmi. Dr. Bhavesh, would you like to share some key message with us today?
Actually, I see a lot of children coming to me with skin vitiligo problem or some other problem which are long term affecting the skin or the mind. Actually, the discrimination first start from the parents. They keep talking about it. They keep talking about a lot of things which are going to happen in future, which may not also, and that impact the child psychology. And I would request that we should teach our patients and their parents that please don't talk too much about vitiligo. Don't try to build up the cascade of events that it will happen like this, then this will worsen, then this will worsen, and that spoil the whole life and the family. So I wish that people should learn about that.
Thank you so much, Dr. Bhavesh. Dr. Shikha, would you like to share a message on World Vitiligo Day today?
My bottom line to all prescriptions and consultations is stress increases vitiligo. So do not stress about it. Just keep on doing your bit and pray for the best.
Thank you so much, ma'am. Dr. Shreya, what would be your key message for us?
Yes, so likewise, I would just like to say that do not get defined or limited by your skin color or skin condition. It is like ma'am said, it's not something that defines your self worth. So just be strong. It can be tough, but I think it's best not to get defined or limited by it.
Thank you so much, Dr. Shreya. Dr. Om, would you like to share a key message today?
Uh, Loss of color is kind of vitiligo. Loss of hair is baldness. So people are living with that. There are some problems, but that is quite acceptable. So it is similar. So live your life, and maybe if you want treatment, there are better treatments coming. Our colleagues are doing good work. So be kind of optimistic, accept it, and move on. Thank you.
Thank you so much, Dr. Mr. Rajiv, one key message that you would like to share with us today.
Yeah, it's a beautiful disease. If you call it a disease, it's a very beautiful disease because it gives you a very different color than the rest of them. So just chill. That's it.
Thank you so much, sir. With that, we're going to close off our today's discussion, and I would like to extend a heartfelt gratitude to all the panelists who have shared, their expertise as well as perspectives with us today. And we would also extend our sincere appreciation to the Pigmentary Disorders Society for endorsing and supporting this World Vitiligo Day initiative, and to the Glenmark for supporting this campaign as well. So, on the behalf of Voice of Healthcare, I would like to thank each one of you who has joined here. Thank you so much for this important initiative.
I'd like to really thank you for what's done and thank you all the panelists. I think it was a very worthwhile, very learning discussion.
Yeah, thank you.
Thank
Thank you.
you,
Bye bye.
everyone.
Thank you
Good.
so
Bye.
much.
Thank you. Thank you.
Thank you. Good day, everyone.